Hello, and welcome to now the fourth episode of the Be Here Now podcast. And today we're going to be talking about probably the most important thing in your life, the most important thing that's ever going to happen to you. And no, it's not your wedding, it's not your football team winning the Champions League, it's your death. And this is a really intimidating subject for a lot of people. It's a bit of a scary subject for many people. And it's something that I've been meaning to talk about for a very long time. Part of the reason it's taken me so long is because it is such an intimidating topic. And even for someone like me, where I've probably had more experience around death and around dying people than many others, I still feel that I really don't understand much about it. And I feel almost a bit of an imposter talking about death as somebody who obviously has never died. And I was struggling with that for a very long time. So it's taken me a while to make this video, but ultimately it is something that I'm really passionate about. And it's something that I feel that we need to talk about more as a society. And that's why I'm making this video. So there's a couple of different ways that most people deal with the subject of death. The most common way, I think, is basically just to ignore it altogether. It's something that we don't think about until we absolutely have to. We kind of think, well, you know, I am a 26-year-old, 27-year-old, or 35-year-old, or 55-year-old, and I don't really need to think about that right now. That is going to happen some way off in the future, and it's just not really something that I need to deal with. And so it just goes straight to the back of our mind. And then when somebody close to us dies, for example, or maybe something happens in the news where a lot of people have died, and it just brings it right back into our consciousness. And it can be very, very painful and very upsetting, and it just sidelines us in a way that it shouldn't really, because it is such an inescapable fact of life. And I think it's important to realize, you know, on a deep level, that this is something that happens to us all. And it's something that will happen to every single one of us, and that there is no way of getting around it. If you were to ask most people, if you had 6 months to live, how would you spend your time? I guarantee a lot of people would say, well, I would go traveling. I'd go traveling the world. I've never seen South America, or I've never been to the Great Wall of China, etc., etc. And my question is, well, if that's what you would do when you had 6 months to live, why aren't you doing that just now? Because even though the time might be different, you know, it might be 60 years rather than 6 months, ultimately, the question is asking you, how do you want to spend your remaining life? And there is a definite time point. There is a definite end point for us. So it's really a question of what's important to you and how do you want to spend your time? And that's the way I think that we should be thinking about death, as a kind of wake-up call, a kind of reminder that everything that we think we have, our material possessions, our car, our dog, our house, our job, even our family, and of course our own personality and ourselves, is ultimately going to disappear. And there's nothing about this life that we can cling on to and bring past the point of death. So I would encourage you all just to take some time, sit down, close your eyes, and just sit with the thought of death, and sit with the idea that one day you are going to die. And whilst this might not be the best exercise for people who are particularly anxious and fearful about death, for basically everybody else, I'm pretty confident that you're going to learn something, and you'll probably realize something important, and it will probably help you prioritize different things in your life, and maybe help some of those less important worries melt away. You know, we all hear these stories about people whose plane goes down in the mountains, or they almost drown in a canoe or something like that. They have these near-death experiences, and they always say that all these tiny little things just seem to fall away. All these arguments with people, grudges that they might have been holding, worries about money or status or, being with the most beautiful person in the world. All of these things fade away when we're really confronted with our own death. But you don't have to have a near-death experience to do that. You can actually just sit and contemplate it in your own time without having to go through the trauma of a near-death experience. So that would be the first thing that I would say, and I would encourage you to do. So I want to talk about death from the perspective of 3 different stories. So 3 people that I've met over the last few years that have taught me something about death. And I'll use that as a way of kind of bringing up different aspects of the idea of death and death in our society. So the first person I want to talk about is Doris, and her name isn't Doris, of course, and everybody's names in these stories have been changed. But I want to talk about somebody who made a big impact on me, Doris. When I was a green first-year junior doctor, having only worked as a doctor for about 6 or 7 weeks at this time, I was looking after a very busy medical ward with about 30 patients, and it was one of those days that many of you who've worked in healthcare will know, where the bosses or the consultants are off the ward, the registrars are off the ward, and I was basically left on my own to look after these patients, obviously with the amazing support of equally understaffed nurses, and we were all doing our best to look after too many people who were all too sick for us. And we had a new arrival, an 85-year-old woman called Doris, who came in with a suspected urine infection, which is a very common problem in older people. Doris was quite confused. She had a background of dementia, all things, of course, that are, again, very common in older people and make it a bit difficult to work out exactly what's going on. But here I am, confronted with this lovely human being who I was trying to establish what has been going on over the last few days, what's been happening to you, what symptoms have you got, etc., etc. And Doris really, really wasn't interested in my line of questioning. She was much more concerned with asking if she could get a lovely sugary cup of tea, which I did for her, and she made sure that she didn't answer any more of my questions until I'd done that. But from the looks of everything that I could see as a doctor, so her kind of observations, heart rate, blood pressure, everything like this was normal, and all the blood test results were normal as well. So I essentially felt that Doris was going to come in, have some antibiotics, and then basically in a few days' time probably go home to where she had come from, and that would be the end of that. So after I'd done my assessment, I said this to Doris. I said that, I think that basically you're going to be okay, and we just need to give you some antibiotics for this urine infection, and things will turn around and you'll be absolutely fine. Doris wasn't having any of it, and she told me quite clearly that, no, this is my time. God wants me. God has called me to be with him, and this is the end for me. And she said it in this such a kind of light-hearted and matter-of-fact way. And out of the confusion of all the other things she was saying, it just seemed so clear that she was certain that this was the way things were going to go. And obviously, me as a 24-year-old junior doctor, thinking that I knew everything, disagreed with Doris's assessment, and repeated again that I thought that she was going to be fine. And really, I think that was my own distress about the situation coming through in not accepting that she was ready to die. Because often in the medical profession especially, we see death as a failure. And although many doctors and nurses might deny that, that is essentially how we were taught. We're fighting against illness, and primarily the outcome that we're trying to avoid is death. in most cases. And I think it's just a reflection of how we see death as a society. We see it kind of as this unnatural thing that really ought not to happen anymore, because we live in the 21st century and we've got this technology and these antibiotics. And, people used to die all the time in the past, but now they don't need to because we've got modern medicine. And I think that when you're not consciously aware of it, that attitude really starts to creep in. And I think that's what was going on in my head while this was all happening. And you might sit there and say, well, she was an 85-year-old lady and she was unwell. But I promise you, it wasn't that obvious to me at the time. But lo and behold, I went home that night. I said goodbye to Doris before I left and said, I'll see you in the morning. And in her head, I'm sure she was thinking, no, you won't. And of course, I didn't see her again in the morning. She died overnight. She had a very peaceful death. Her family were spoken to about it, and the night staff did an incredible job in keeping everybody up to date with what was happening. But when I came in the morning, my first reaction was to be very surprised about what happened. But also, I didn't feel in any way upset about what happened. And usually I do feel obviously upset when people die. But I knew that Doris knew that this was going to happen. And I knew that it was almost her choice that this was going to happen. And this isn't the only time that something like this has happened in my medical career. That basically, often people get a sense of when their time has come, so to speak. And I really feel that Doris had that at that point. She was what I would call a spiritually enlightened being who really was aware of the fact that she was going to die. And she was completely at peace with that fact. And that made her death obviously easy for her and acceptable to her. But it also changed my perspective on her death. And I know that speaking to her family afterwards, that it made a big difference to them as well. And that's something that Doris had to do by herself. She was carrying the entire burden of that decision because it was going against what my assessment as the doctor was and what I was trying to do as the doctor, and I'm sure in some ways what her family were trying to do as well by not wanting her to die. And this is something that I've seen over and over again as a doctor. Often it's the medical staff and it's the family who aren't ready to let go. So another story that I think brings this to light as well is something that happened much more recently. I was actually out surfing and I bumped into a kid who we'll call Tom. And he was probably a 16, 17-year-old kid who was one of these lovely people who within about 5 minutes of talking to them, you already know everything about their life story and, their deepest, darkest fears. And so within 10 minutes or so of having a conversation, he was telling me the very difficult and painful story of how his uncle had died about a year ago from cancer. And his uncle, I presume, was a kind of middle-aged man, and obviously by society standards died much sooner than he really ought to have. But I was really interested in the way that Tom spoke about this event, because when he was telling me about it, he described it as, well, my uncle stopped fighting, is what he said. He stopped fighting, he gave up, and apparently on the last time that Tom met his uncle said to him, look, I'm done with this. I really can't be bothered with this anymore. And I just don't want to fight this anymore. And apparently the doctors at the time had said that he should have about 12 months to live. At least this is what had been relayed to Tom. And Tom and the family certainly felt that he had a lot of time left to go. So again, as often happens, Tom said goodbye to his uncle, thinking that he was going to see him in the next day, and his uncle died overnight. And the way Tom spoke about it, what struck me really deeply was how upset that he was, not just about the death itself, but about the idea that his uncle had stopped fighting and how he had somehow given up. And there was an implication that he was disappointed and that his uncle had let them down, and that he had almost acted in a cowardly way by stopping fighting against this illness. Now, the first thing I'd like to say about this is I know that the fight against disease and the fight against cancer is a really, really powerful narrative that lots of people use. You think of people like Lance Armstrong, who overcame these incredibly unlikely circumstances where everybody thought medically that they were going to die. And I know that people use this as a way of creating a positive mindset to get through difficult times. So I don't want to downplay that in any way. But in this particular situation, it seemed to me that the family, and possibly the uncle itself, had been viewing this as a fight between me and the disease, and me and death. And I'm fighting off death, and I'm trying to conquer death and beat death and turn things around so that basically I can eradicate this disease and continue to live my life in a normal way. And I think that this pattern of thinking can be really unhealthy, and it can create a lot of pain for us. And it obviously, in Tom's case, had created a lot of pain and disappointment, which is a shame, because that is probably the last impression that Tom's uncle was maybe getting from his family members. And he might have been living with this idea that actually he was letting them down. When he had the same realization as Doris did, that actually my time has come. And very quickly after he realized that he was going to accept death as it was and not fight it anymore, he was able to basically be at peace with it. And I hope eventually that he died in a peaceful way. And I think instead of creating this narrative where we have to fight off death, that maybe we should take a more accepting stance towards it. Because if we're constantly thinking about death as some opposition fighter that we've got to wrestle off our whole lives, but ultimately get beaten by, ultimately this is an opponent who has conquered every one of us since the beginning of time. What is the point in living your life in a way that you're always trying to fight something that's inevitable? If you can't be at peace with the idea of dying, it's going to create a lot of suffering for you, and it's going to create a lot of suffering for your family. Now, lots of you have asked me, what's it like to be with somebody at the moment of death? And that brings me to my final story about a man named John, who is an elderly patient I was looking after in March of last year. He was a man who was actually dying of COVID. This was during the first wave of the pandemic, and he was an elderly man, as I say. He had an elderly wife who was also unwell, and she wasn't able to come and visit him during those last few days of his life. And that meant that for a lot of that last few days, John was actually on his own. And I remember walking onto the ward one day and seeing that his breathing had deteriorated significantly. And just from the look of him, I could tell that he was going to be dying in the next few moments, really, in the next few minutes, the next half an hour or so. And this was something that we'd all expected. The medical staff, the nursing staff, his wife knew that this was going to happen, and John himself had known that he had this irreversible illness, or had gotten to that point, and he was getting worse and worse, and he was okay with the fact that nothing else was going to be done. But by the time I saw him, he was very, very much at those last few moments of life, and completely unconscious as far as I could tell. So as a doctor, there wasn't anything for me to do for him. He wasn't in pain, he wasn't distressed, there certainly wasn't any medications for me to give him, and there wasn't anything reversible that I could change about what was going on. But I'm sure lots of you would understand when I say that as a human being, I felt like the best thing that I could do in that moment was just to be there with him. So I pulled up a chair in that little side room that John was in, and I just sat with him and shared those last few moments with him. His breathing started to slow down. He was taking these long pauses between each breath, and eventually he took in a really big, deep inhale and then a large exhale as his final breath left his body. And in that moment, it reminded me of something that one of my great spiritual teachers, Ram Dass, used to say. And he used to say that death is like taking off a tight shoe. And I think that's the perfect way to describe what it felt like to be in that room at that moment, where John had gone from being so tired at the end of his life and struggling with the breath to suddenly this huge sense of release and relief as the breath left his body. And if you've ever been with somebody after they've died, it's not like they're just asleep or that they're just lying very still and not breathing. It's really obvious that there's some animating life force within them that is no longer there. And I think animation is the perfect word, because anima actually comes from the Latin of soul or breath. And I guess depending on your interpretation of that, makes a difference to what you think actually happens in that moment. Some people would say that it's simply just the breath leaving the body. But for me, it feels like there's something else that goes with that, that really it's just this life force that lights up each of us, and at that moment of death is released from the body and into the atmosphere around. And that's exactly how it felt to be there in that moment. It was very peaceful, and it wasn't upsetting, and it was just an incredible honor and a privilege to be there at that time. So if any of you ever happen to be in that situation, I would just encourage you to try to be as present as you can. Just be there with that person and try to put aside all those thoughts and all those feelings about what you think that you might be losing through this moment of death. But just to be there in that moment with this person, and I'm sure that you'll feel that sense of deep release as well. And so this brings us to the end of our video. And there's just one final thought I'd like to leave you with, which was inspired by one of the questions that you guys asked me yesterday on Instagram, which is, what happens to consciousness at the moment of death? And I guess this is the greatest mystery of all. And it's something that I don't have an answer for you. It's something that you're going to have to think about yourself, about what you think happens at the moment of death. And that might very well be influenced by your spiritual perspective. Maybe you think about death through the framework of a religion that gives you an idea of what might happen. But ultimately, it's a question that we all have to face up to, and it's worth thinking about in your own time and contemplating really what you think that moment of death brings. But something from me that really speaks profoundly about what happens to consciousness at the moment of death was something that another great spiritual teacher said, Ramana Maharshi, who was a great South Indian sage who died at the beginning of the 20th century. And as it became clear that he was becoming more unwell and that he was going to die very soon, his devotees came up to him, and one of them said one day, "Teacher, please don't go. Please don't leave us. Please don't go." And Ramana Maharshi simply turned and said, "Where can I go? I'm right here." So thank you so much for watching this video. It really means a lot to me. It's taken me a long time to put out this video because it's a difficult subject to talk about. And as I said earlier, it's something that I almost felt not qualified to talk about. But ultimately, none of us are, because none of us know what's going to happen. But it's definitely something that I want you to think about. Hopefully a long time before you ever actually have to die, you can contemplate death and get a fuller experience of life as a result. So I just want to leave you with one final quote, and it's from perhaps the greatest spiritual teacher of all time, Gandalf from Lord of the Rings. And this is something that he says to Pippin as the orcs are trying to bust down the gates of Minas Tirith. And Pippin, like all of us, is very anxious about death and what it means. And he turns to Gandalf and says, "Is this the end?" And Gandalf says, "Death is not the end. It's just another path, one that we all must take." So thank you very much for listening. I hope you enjoyed. And if you want to comment or get in touch with me, that would be very much appreciated. And if you really enjoyed it, feel free to share. But for now, peace out.